Epione Pain Management Center. ఇక్కడ మీ నొప్పులు శాశ్వతం కావు.
Hi, I'm your Dr. Minal Chandra, co-founder of Epione Pain Management Center and chief consultant. So a lot of patients comes to me and they ask me, are you going to give steroid? And I realize that steroid is such a big scare to patients. So let me just talk about steroids today. Now steroids are nothing but these are just the artificial preparations of the hormones which are present inside. What I mean by that is steroids are already present inside our body also. So there are glands which will secrete steroids in different form, because this is one of the very important hormone to keep us alive. It helps in different activities and it has different function in the body. Now when it is present in the body, why do we need artificial steroids? There are certain conditions like some autoimmune conditions like rheumatoid arthritis, psoriatic arthritis, lupus, SLE, some conditions changes in the eye like uveitis, and some skin conditions where steroid has a very important role. So steroid is like a double-edged sword. It is sometimes life-saving and sometimes it can ruin your life. So now how do we understand that how steroid is going to save our life and how it can ruin our life? Like I said, few conditions like rheumatoid arthritis, very common condition of pain, knee joint pain, will definitely have the role of steroid. So if you're diagnosed with rheumatoid arthritis, if your RA level factors are high, you have to use steroids. Now how to use it, when to use it, and what are the precautions to be followed. Now steroids are something which has to be taken only when your doctor has prescribed it in a form the way your doctor has prescribed it. Do not underdose it, do not overdose it, and you use it only till the time it has been told to use by you. So we have seen sometimes when your pain has come down, the patient tends to overuse it because they think that if I'm going to use this tablet, my pain will come down, and this is called as overuse of steroid and abusing your steroid, and this is when the side effects of steroid will start coming. Similarly, so many times if you go to a dermatologist and for some reason, so for your skin condition, if they have given you steroid, you tend to use it for long and then the skin thinning and all those things starts happening. So make sure that you're not overusing your steroid and it has to be used as it is prescribed by the doctor. Now as a pain physician, why this is important to me to talk about steroid is because steroid, after being used in few important conditions, when it is overused, it leads to something called as weakening of the bone and making you more prone for fracture. So when it is very important for you, you need to take care of your bones. How to take care of your bones is by maintaining good hydration, maintaining good diet, keeping your vitamin D levels at check, getting your bone mineral density checked, so that if your bone mineral density is less, you can take care of it before only, and then it can prevent you from going for any fractures, or because your bones are osteoporotic, so you become prone for fractures. So this is how you need to take care of your steroid. And finally, if you have been put on steroid and if your dose is for 5 to 10 days, do not stop it suddenly. You have to taper the dose. So when I mean to taper the dose, it means that you have to keep on decreasing the dose every day, and finally you have to stop it at the most low level of dose that you are taking. So make sure that you follow all these points before you stop your steroid. So like I said, steroid sometimes is very important, but only when you take it within the dose prescribed for the duration that has been prescribed. Do not abuse the steroids, and when not required, please don't use steroid as a sole medium to take care of your pain, because this may lead to weakening of bone. So only if your condition requires steroid, take it, otherwise please avoid it.